Good afternoon. It is Thursday, May the 27th, 2021. Sego, David Lahashu Judson, and welcome to today's edition of the COVID-19 Task Force Update on this, our 213th episode of Kahnawake 911. Joining us today will be Alana Atwin from KSCS, and we'll also hear from Lloyd Phillips, Commissioner of Public Safety, who has a lot of very important information and information you've been waiting for. So we'll kick off this show with Alana. Alana?
Nyawa, Dave. Nyawa for inviting me to come in today. My name is Alana Atwin. I work at the Family Wellness Center. I'm a parenting support worker. And I was invited in here today to talk a little bit about how to talk to children and teens about the COVID-19 safety measures. So as you know, as of last Friday, Kahnawake went into orange alert, which loosened restrictions in the community. That's today, but as we all know, things may change. Some children and teens may still be having difficulty understanding why we have to stay away or stay far away from our friends and our family, and how do we continue to explain these challenges and these changes to our children and teens? What do we do if they don't want to abide by these restrictions and safety protocols? Children aren't yet vaccinated, so we may want to take extra precautions for them. But on the same note, we have to acknowledge that after 16 months of being isolated and restricted from going out and visitation, that some of these children are going to have a lot of anxiety adjusting back into what we consider normal. They may have the same anxieties adapting to the lessening of restrictions as those that we had adapting to the restrictions themselves. So I just wanted to offer a few tips to parents and caregivers to talk about how to talk about these changes with their children. So with children, younger children, be aware of how you talk about COVID. Your discussion can increase or decrease your child's fear. If true, remind your children that your family is and continues to remain healthy and that everything you do is to ensure that they continue to be. Ensure that they understand how and why we have to social distance to keep our community and family members safe. On the same note, explain why things maybe need to reopen. Businesses need to provide for the community, and business owners have to provide for their families too. Teach them easy stress management techniques. Deep breathing is an easy one. Go outside, go for a walk or a bike ride together if you can. Focus on the positive, celebrate having to spend more time together, do family projects, maybe invite them to do things that you wouldn't normally, like wash the car, help you clean the basement, or clean out the closets for the spring. Establish and maintain a daily routine. This is always really important with everybody. It helps to provide a sense of control, predictability, calm, and well-being. Let your children's questions guide you. Answer them accurately by making sure you have correct information. There's so much misinformation available at the tips of your fingers on the internet, so make sure that you're getting the information from reliable sources, including the COVID-19 website, which is where my go-to is. And importantly is be aware of your children's mental health. Look for changes in sleeping and eating habits, regression in younger children. They may resort to bedwetting, thumb sucking, withdrawal from family and friends are signs in teens. And again, adjusting to the lessening of restrictions could have an impact on them too. You know, there's going to be a lot of, activities within the province opening up. And while you may be comfortable, maybe you're vaccinated, you're comfortable in going and attending, open venues, your children, because of what the messages that we've been sending, may be experiencing anxiety about going out. So be aware of that. It's just something else that they're going to have to adjust to. With teens, it's a little bit different. First, if the issue is with your teen not following the restrictions, so even though we've gone into orange, there's still restrictions that should be followed, but try to understand why they're defying these restrictions. Do they find it difficult or don't understand how their behavior could endanger others? Or do they want to violate the rules because they're naturally defiant? Is it a combination of the two? Have a conversation with them. Explain the science behind it. We announced just recently that we're having vaccinations in the community for 12 to 15-year-olds and second doses for 16 to 17-year-olds. But even though you're vaccinated, doesn't mean that you're immune and that you can't carry it on to someone else. Explain that, on that same note, explain that the risk is not just about them. It may not be the worst case scenario for them to get COVID, but the risk to spreading it to someone who's at risk is a big deal. Emphasizing how violating guidelines could be putting the community at risk, and include grandparents, parents, and other immunosuppressed individuals in the community. If this doesn't help, remind them that there's always consequences to violations. The peacekeepers have instituted a great initiative to positively reinforce behavior that is keeping the community safe. So going out and giving initiatives to kids that they're seeing gathering safely. So we remind them that there's sometimes it pays to do good deeds. And if you're noticing even more defiant behaviors related to following the safety protocols, or even anxiety to adjusting to the lessening of the restrictions, we encourage you to talk to your teen. Maybe they're struggling emotionally, and KSCS is there to support them through that. And I have to stress that with both children and teens, one of the most important ways for parents to support their children is to act as a role model. When our frustrations or anxieties are expressed in front of our children, it causes confusion. They continuously hear the importance of the protocols in place. We hear them in social media, on the radio, through this, the live updates, but also hear our annoyances with following those protocols or the fears of them lifting. So developmentally, you may know that teens and children, their brains aren't developed as adults are. The frontal lobe, the processing and logic processing of information is different. It's usually not developed until 25. So, we may experience anxiety or frustration with the restrictions, but are able to just adapt and put our masks on and go do what we need to do. But teens and children may have more difficulty processing, well, if I'm hearing one message and my parents are doing another, it's harder for them to kind of think through that. So just be cautious of your language and be conscious of how you're speaking about your fears and your anxieties in front of your children. So on that note, I just want to promote some of the programs that we have running at the Family and Wellness Center. We have a weekly women's group. It's a closed group running right now. It's hosted by traditional support worker Mary Gilbert. It's run, it's closed. There's people that are clients are participating in the group, and we hope to have more like that in the future. We do have an open men's talking circle. It's Tuesday evenings from 6 to 8 p.m. It will be continuing after this session ends in June 1st, because the men that are in the group are really enjoying their experience. It's facilitated by traditional support worker Tom Deerhouse and Cody Martin at the Family Wellness Center. It's online. Spaces are available for any men that are interested, and activities include guest speakers and activities, and we're hoping to possibly maybe meet in future in person at the Family Wellness Center. Last night we started a support group for parents of teens. The entire parenting team, Trudy Jacobs, Frankie Massica, and myself, are hosting a weekly get-together from 6 to 8 on Wednesdays. And it's for anybody who's a caregiver or a parent, could be a grandparent who's struggling with supporting their teen through anything, through anxiety, through motivation for school. We're ending the school year. There's a lot of kind of exams coming up, and it's been a difficult year, but anything related to parenting teens. And we had a really great conversation with some parents last night, and it's an open group, and we invite anyone who's interested and who wants to join us to contact us, and I'll give you contact information at the end. We also have What's for Lunch. It's going to be continuing. It's Frankie Massica and Chantal Haddad from the KMHC who run that every Wednesday, usually 4-week sessions, and we film live at 11 o'clock in the morning on Wednesdays. We're going to be starting that again on June 16th. So if you're interested, you can register with Frankie at frankiem@kscsganawage.ca. And on Monday, May 31st, we are really excited about this conversation we're going to be having, because if you're a mom or any parent, but I'm a mom of a 15-year-old, this is going to be an interesting topic. And we're going to have Paul Davis on our Roundtable Talk, which is our Facebook Live talk show on Monday at 2. He's an online and social media safety educator. And if you Google him, look at his talks, he's no holds barred, talks the hard facts about social media, age limitations, liability of parents, and who's paying for the phone versus who owns it, who's liable if something happens within that, having that phone, with sending messages and photos and cyberbullying and all those kinds of things. So that's going to be a really interesting conversation. If you want to watch that live, or you can submit comments during the live or through Facebook Messenger, and we can pose them to them privately. So we hope you can tune in for that. And on the last note, for any parenting support, please don't hesitate to contact us. Frankie, Trudy, and myself are working from home, but we're always available to answer any questions that parents might have about challenges that they're having with children, with families. just anything in general, just a place to vent. You don't have to be a client. You can call us for just some information if you need help finding a resource. But if you're really struggling, you can, you can call intake at 450-632-6880, or you can call the Family and Wellness Center directly at 450-638-0408 and ask for one of us. And we're always, like I said, we're always available to answer any questions and to be there for you as well. And for any of the programs, if you're interested, you can email parenting@ksskanawake.ca, and we really hope you take advantage of it and join us. We look forward to spending some time with you and supporting you as well. Nyaoko.
Thank you very much, Alana. Very informative, and hope to have you on the show again soon sometime. Coming up next is Lloyd Phillips, Commissioner of Public Safety, with some new details and very important information for you. Lloyd?
Thank you, Dave. Thank you for the information. That was really interesting to, as I was listening, regarding the measures and the reduction of measures and the possible impacts on the youth and I guess adults for that matter as well. It's you think of reduction of measures as a positive thing, which it is, and we'll be speaking about that in a little bit. But you also have to understand that, yeah, it does have impacts on everybody's lives, and not necessarily always positive. And there's going to be certainly going to be an adjustment for everybody, to get back to again, like we said, whatever that new normal is going to be. It's going to take a lot of adjustment for everybody. So overall, we've been monitoring what was happening, in and around Kahnawà, as we always do, Greater Montreal area. And as we know, last week we moved Kahnawà into the orange level alert, lowering the level of alert by a little bit, and which also was allowed for the first phase of the reopening of some of the businesses and that have been closed, as well as having a little more ability for family get-togethers and such to gather in safe ways. So that started last Friday, and it's been rolling out very well. As with everything that happens, and it's sometimes things are very complex and there's a few glitches in the way things roll out, but certainly overall things have worked out very well. Situation in Quebec continues to improve. They have seen some of the lowest cases per day in the past few days than they've seen in a long time. So again, very positive news there. Montreal is looking at moving out of red zone, if everything goes well, into orange in early June. So that's again the positive news, and it does obviously impact our community. So let's hope that things remain on that track. But more locally, as we speak, we have 0 active cases of COVID-19 in Kahnawà. This has been the case for the past little while, but we're certainly proud of the fact that we are at 0, and let's look at following measures and maintaining what we're doing to ensure that we keep any cases to a minimum, and any outbreaks, if it does happen, true openings or otherwise, that is contained quickly as possible. So we did have a lengthy task force meeting yesterday, and we have put together some plans over the past several weeks on what the, again, gradual reopening would look like. Phase 1 is already in place, and we are going to be looking towards a 4-phase process that would eventually lead us back to, again, whatever that new normal is going to look like. Because the way things were pre-pandemic and the way they're going to be after everything reopens in and around Kahnawà is not going to look the same as it did prior to. So before we get back to anything that resembles pre-pandemic, it's going to be a matter of many months, not only in Kahnawà, but certainly around the world. But we have a 4-stage plan or 4-phase plan, and we're looking at the second phase to kick in tentatively. We always have to say tentatively because there's so many unknowns regarding cases and stuff, but we're definitely targeting June 4th, Friday, June 4th for phase 2 to kick in, which includes several factors: outdoor public and private gatherings, that could increase from where it is now at 12 people maximum to 25 people, provided that you have proper space and distancing measures. So that's keep in mind, outdoor is the key here, because we want to make sure that we minimize any possible spread of the virus, and it's proven that outdoors is much more safe. Indoor private gatherings, we're going to also increase that to 2 households. Right now, as you know, we can have 1 additional household in your home visiting inside. But as of June 4th, we feel confident that we're able to expand that so that 2 other households could gather safely in each other's homes. For example, some people have 2 children who are live in separate households, who they maybe have been visiting only one at a time. This would permit the fact to have both those children gather with the family together. Churches and funeral homes and ceremonial gatherings, the increase of capacity to 50%. Restaurants will also have the ability to expand their capacity to 50%. Gyms and fitness centers, our capacity will be increased to 12 persons. Gaming establishments in the community will start their orange phase reopening plan, which is a pre-approved plan, which was done last year and updated. So they will have that opportunity to start their orange phase reopening on the 4th. And as well as the cigar lounges for anybody who outdoor terraces, again, increasing the capacity on there. As well, the alcohol sales in the community, for like say cigar lounges and such, would be also permitted. But at this point in time, the actual bars and bar areas will remain closed. There is a lot of documentation, and what you see on the screen now is phase 1, 2, 3, and 4 over the next couple of weeks, and we have tentative dates set there. So our goal is every couple of weeks to move into the next phase after we deem it's safe to do so. We want to put dates up there so that we're able to show people what our goals are, and for people who have to plan or want to plan, at least they see targets there. But again, we will do our best to maintain these dates, but we can't certainly guarantee, because again, like I said, there's many areas that are still unknown. And as we move through the phases, phase 2, 3, and 4, there is a gradual relaxation or reduction in measures, leading us to early summer, where we feel that all things considered, we will be as safe as we can be. So that document, which you see, is going to be uploaded to our on all mediums for that matter, but it's going to certainly be on Kahnawake911.com. It'll be released, on our Facebook page and such, where you can look at it in much more detail and see where things fit in for you as an individual. Just one note on there when it talks about capacity in restaurants and churches and other areas. There's always a little asterisk besides there, because we're talking about the capacity is based upon still maintaining preventative measures in place. So 75% or 100% capacity is not necessarily what it was, again, pre-pandemic. It's still based upon the fact of needing to have distancing between tables, distancing between certain clientele and such. So that capacity still has a little caveat there, a little asterisk that it's based upon, including the preventative measures. As well, we do understand that there is a great diversity of businesses in the community, and we can't possibly have every single measure meet the needs of every single businesses. So we have been doing some outreach, and we will continue to do outreach to various businesses to ensure that these general rules apply. But if there is certain nuances or certain little areas that we have to consider, we will be doing so as it moves on. Similarly, for people who want to have different types of get-togethers, public or private, if there's day camps and stuff that are being worked on, they have been submitting safety proposals and safety guidelines that we're able to look at, and if deemed appropriate, are approved. So we're trying to be as proactive as we can, and we're trying to move in a way that we feel is safe and secure for our community. But again, be conservative. And I want to repeat what I said during the week as well on the radio, that some people feel that moving every 2 weeks down this path is moving too quickly. And other people feel obviously that it's a bit too slow. So I think we're kind of going down the middle here, where we're feeling, based on the science that we're looking at, as we said from day one, the science was what's going to guide us, and we feel confident that this is the right steps to be taken at this particular time. And considering the fact we're in a very good place as a community. We're ahead of Quebec, we're ahead of Montreal in vaccinations, and we're in adherence to measures as a community. We are much more, I guess we have been much more vigilant than many places, and now we're starting to, I guess, reap the rewards from that. So with that, we want to make sure that people are aware that this is the path forward. We are going to be assessing it literally on a day-to-day basis. And if there's going to be any significant modifications to the plan, we will make that public as quickly as possible. But again, through community cooperation and such, we will also be able to, I guess, get there together. One other note I just wanted to mention regarding all these the plans for the businesses, and again also on June 4th, the restrictions for Kahnawake only or residents only for restaurants and such will also be lifted on June 4th, allowing for non-local clientele to use the businesses within the community. This provides more opportunity for businesses to get back on the right path, and it also has time, as we've seen more and more people outside Kahnawake are being vaccinated, and their rates of vaccination are going to be getting better as the weeks go on. Speaking about vaccination, I just want to also remind the community that vaccinations will start for the age group of 12 to 15. You can go on Kahnawake911.com and click the Click Santé link and book an appointment for the 3rd, 4th, or 5th of June. And again, we are amongst the first in the country to be vaccinating that population. So please, I encourage everybody to take advantage of that because later, in the later part of June or early July, we will also be looking at second doses for that age group. So we do have the ability to have our youth, 12 to 15, vaccinated fully, by early summer, and certainly that makes a much more positive look towards reopening schools come September. So it's a part of a larger picture: protect yourself, protect your family, and also protect the community, and allowing schools to reopen as normal as possible come September. As well, the weeks of June 7th, 14th, and 21st, we'll be getting 1,000 doses per day, per week of vaccination. So we will be doing the mass vaccination for Kahnawake throughout the month of June. So again, we're about 2 to 3 weeks ahead of schedule. Which I'm very happy we are, but that did create a little bit of logistical issues, as I know many people were issued appointments already when they got their first vaccination, and some were up until mid-July. So all those appointments that were issued, if not already done, very soon over the next few days, you will be getting a text message and/or an email, which is going to cancel that appointment that you were originally given, and you're going to be rebooked for an appointment which is going to be a few weeks earlier. So you'll be getting those messages in the next few days. Again, I ask the community to be patient. they do have over 3,000 appointments to cancel and rebook, so it does take time. And we're certainly encouraging anybody who gets their new appointment, do your darndest to keep that appointment. It is your spot to get your second vaccination and be fully vaccinated. As we've seen, the vaccinations have been successful in around the world and in the community. The second level or second vaccine or being fully vaccinated, there's more and more evidence now that's showing that the efficacy rate amongst the variants of concern, including the known as the Indian variant, have proven to be effective against those. So with the 2 vaccines, we are going to be as protected as we can be. So again, that's one more reason why I want to encourage people who got their first vaccine to please make sure that you do follow up and get your second vaccine. Again, it's in everybody's best interest, and ultimately the collective of Kahnawake will be protected. With all this information and moving down that path of reopening in a safe way, more and more vaccinations rolling out, second doses rolling out. We are hoping, throughout the next several weeks, within the next month or so, where we could even look at downgrading even further. With everybody's cooperation, everything going in the right direction, we could see going from orange, we could see going down into a yellow zone, and then eventually back down to green. So that's the path. We said it before about that light getting brighter at the end of that tunnel. I know it's been a long tunnel, but we certainly see that light getting brighter and brighter. And here is a clear path on how we could do it safely. We could get the economics of the community back on track, personal freedom, so to speak, back open, meeting with family and friends in a more meaningful way. Having those family get-togethers in a safe way is all part of recovery, that we need, from the pandemic. And as Alana mentioned, it does impact on everybody in a positive way, but we also have to be also mindful that some people find this a very stressful time as well. Again, sticking together as we did for the past many months as a community, we will continue to persevere, and we will continue to do what we need to do to keep our community safe. Kahnawake.
Thank you very much, Lloyd. A lot of information to digest, but some good news for sure. And that's it for our program this afternoon. From all of us here, Kahnawake, Danu, Onagiwahi.